Psychoanalysis in Psychology Introduction. The birth of psychoanalysis. Psychoanalysis emerged in the late 19th and early 20th centuries as the first formal school of thought in psychology to focus systematically on unconscious processes. Founded by Sigmund Freud, psychoanalysis revolutionized the understanding of human behavior by asserting that unconscious drives, childhood experiences, and repressed emotions shape personality and psychological functioning. Unlike behaviorism, which emphasized observable behavior, or functionalism, which focused on adaptation, psychoanalysis delved into the inner world of the mind, dreams, desires, traumas, and defenses. Though it began as a clinical approach to treating mental illness, psychoanalysis quickly evolved into a broad theoretical system influencing psychology, psychiatry, literature, and the arts. Historical and philosophical background. Freud's ideas developed within the intellectual context of late 19th century Vienna, where neurology, philosophy, and emerging psychological theories intersected. Freud was initially trained as a neurologist and became interested in the psychological causes of hysteria, a condition marked by unexplained physical symptoms. Influenced by the determinism of natural science, the hypnosis techniques of Jean Martin, Charcot, and Joseph Breuer, and the unconscious mind described by philosophers like Schopenhauer and Nietzsche, Freud formulated a new approach that emphasized internal conflict and hidden desires. Psychoanalysis was not just a method of therapy. It was a comprehensive model of the human psyche, proposing that much of human behavior is irrational and rooted in unconscious processes. Core concepts of psychoanalysis. A. The unconscious mind. Freud's most radical idea was that the largest part of our mental life, including desires, memories, and motivations, lies outside conscious awareness. According to Freud, the mind is structured into three levels: conscious, what we are currently aware of; preconscious, thoughts and memories that are not in immediate awareness but can be retrieved; unconscious, repressed memories, instinctual drives, and unresolved conflicts. The unconscious mind exerts powerful influences over thoughts, behaviors, dreams, and symptoms, often in ways the individual does not realize. The structure of personality. ID, ego, and superego. Freud proposed that personality is composed of three dynamic structures. ID, the primitive, instinctual part that operates on the pleasure principle, for example, sexual and aggressive drives. Ego, the rational self that operates on the reality principle, balancing the demands of the ID and superego. Superego, the moral component, representing internalized societal and parental values. The ego must constantly mediate between the unrealistic demands of the ID and superego, often resulting in internal conflict and anxiety. Defense mechanisms to manage the anxiety caused by internal conflict. The ego employs defense mechanisms, unconscious strategies that distort reality to protect the individual. Common examples include repression, blocking distressing thoughts from awareness; projection, attributing one's own unacceptable desires to others' displacement; redirecting emotions to a safer target; rationalization, creating logical excuses for irrational behavior; sublimation, channeling unacceptable impulses into socially acceptable activities. These mechanisms help maintain psychological balance, but can contribute to neurotic symptoms when overused. Psychosexual stages of development. Freud theorized that personality develops through a series of psychosexual stages, each associated with a different erogenous zone. Oral stage, 0 to 1 year. Pleasure centers on the mouth. Anal stage, 1-3 years. Focus on toilet training and control. Phallic stage, 3 to 6 years. Identification with same-sex parent. Oedipus electric complex latency stage, 6 to 12 years. Repression of sexual impulses. Focus on socialization. Genital stage, 12+ years. Maturation of sexual interests and adult intimacy. Fixations or conflicts at any stage could result in personality issues later in life. Methodology and therapeutic techniques. Psychoanalysis introduced a new model of talk therapy, emphasizing dialogue between therapist and patient to uncover unconscious material. Free association patients are encouraged to verbalize all thoughts without censorship, allowing unconscious material to emerge. Dream analysis. Freud believed that dreams are the royal road to the unconscious. Therapists analyze manifest content, what the dream appears to be about, and latent content, the hidden symbolic meaning. Transference and countertransference. Transference. The patient projects feelings about significant others onto the therapist. Countertransference. The therapist's emotional response to the patient, which can offer insight but must be managed. Professionally. Resistance. Patients may resist recalling painful memories or accepting interpretations. Resistance is seen as a sign that the unconscious material is significant. Key figures in psychoanalysis. Sigmund Freud, 1856 to 1939. Founder of psychoanalysis, published The Interpretation of Dreams. 3 essays on the theory of sexuality. Civilization and its discontents. Developed the concepts of repression, the unconscious, and infantile sexuality. Carl Jung, 1875 to 1961. Originally a follower of Freud, later founded analytical psychology, introduced concepts like the collective unconscious. Archetypes and individuation, emphasized spirituality and symbolic meaning over sexual drives. Alfred Adler, 1870 to 1937. Developed individual psychology focused on inferiority complex, social interest, and goal-directed behavior. Rejected Freud's emphasis on sexuality in favor of social and motivational factors. Anna Freud, 1895 to 1982. Extended her father's work on defense mechanisms. Pioneer in child psychoanalysis. Erik Erikson, 1902 to 1994. Developed the psychosocial theory of development, extending Freud's ideas into adulthood. Proposed 8 life stages, each involving a psychosocial crisis. For example, identity versus role confusion. Applications and influence. Psychoanalysis had a profound impact across multiple fields. Clinical psychology and psychiatry. Foundation of psychodynamic therapy, still widely practiced today. Informed understanding of mood disorders, neuroses, and personality disorders. Literature, art, and film. Psychoanalytic theory influenced literary criticism, surrealist art, and film analysis. Themes of repression, the unconscious, and dream symbolism are common motifs. Child development emphasized the long-term effects of early childhood experiences and parenting-inspired attachment theory. Developmental psychology and educational approaches. Culture and society. Freud's ideas helped explain societal phenomena like religion, gender roles, and human aggression. Psychoanalysis laid the foundation for critical theory. Feminism and cultural studies. Criticisms of psychoanalysis. Despite its influence, psychoanalysis has been subject to substantial criticism. Lack of scientific rigor. Many concepts, for example, Oedipus complex, are unfalsifiable and based on subjective interpretations. Parenthesis on sexuality and childhood. Critics argue that Freud gave disproportionate weight to sexual development. Gender bias. Freud's theories have been criticized for portraying women as biologically and psychologically inferior. Cultural limitations. Psychoanalytic theory was based largely on the experiences of Western upper-class patients. Time-consuming and costly. Classical analysis can take years and is not accessible to many people. Legacy and contemporary relevance. Psychoanalysis has evolved and adapted over time. Modern offshoots. Object relations theory, for example. Melanie Klein, Donald Winnicott, focuses on early relationships and internalized objects, mental representations of people. Attachment theory, for example. John Bowlby merges psychoanalytic and ethological approaches to explain bonding and separation self. Psychology, for example, Heinz Kohut, emphasizes the development of the self and empathy in therapy relational psychoanalysis, focuses on the co-constructed relationship between therapist and client integration. With neuroscience, contemporary neuropsychoanalysis seeks to bridge the gap between Freud's ideas and modern brain science, exploring unconscious processes and emotional regulation. Psychoanalysis was the first psychological school to offer a comprehensive theory of personality, development, and mental illness. Though it has been revised and challenged, its core contributions, such as the importance of the unconscious, childhood experiences, and internal conflict, remain central to modern psychotherapy and personality theory. Freud's influence extended beyond psychology, reshaping Western culture's understanding of the human condition. Today, psychoanalysis endures in clinical practice, interdisciplinary thought, and as a continuing source of intellectual innovation.